Dr. Celeste Chavis is a professor at the Department of Civil Engineering, as well as the Department of Transportation and Urban Infrastructure Studies at Morgan State University, where she serves as interim chair. She holds a Doctor of Philosophy in Civil and Environmental Engineering from the University of California, Berkeley, and is a licensed professional engineer in the state of Maryland. Since joining Morgan in 2013, Dr. Chavis has been the principal investigator or co-principal investigator in research awards totaling nearly $14 million. Her research focuses on transportation operations, safety, and performance metrics for multimodal transportation systems through an equity lens. Her recent work includes topics on food access, public transit operations, pedestrian and bicycle safety, and travel behavioral modeling. Dr. Chavis is also active in her local and professional community. She recently co-chaired Baltimore Mayor Brandon Scott's Transportation and Infrastructure Transition Committee, is vice chair of the Central Maryland Transportation Alliance Executive Board, and serves on 2 Transportation Research Board committees, those in equity in transportation and in bicycle transportation. Most recently, she was appointed to serve on the Baltimore Regional Transit Commission as well. In today's episode, we will be answering questions related to equity and engagement in transportation research. In essence, we will be thinking about what does this concept of equity mean in the context of transportation development and research? How do we measure it? What are the nuances and tensions within it? And ultimately, how can we as researchers, as planners, as developers, make data-driven decisions that improve social outcomes for residents? We'll be doing a deep dive into Dr. Chavis's research at one point, and in the end, we'll kind of conclude with thinking about how we engage with civic organizations and civil society, applying research in the real world, which is a main theme of this series. So just to set a few things on the table, Dr. Chavis, let's start really simply. What does equity mean to you as a transportation researcher in the fields of urban planning and transportation?
Sure. First, thanks for having me. I'm honored to be the first of this monthly series for the Smarter Center. So equity, it's such a tough thing to define sometimes. You know, right now, I would say it's the buzzword du jour, where we see equity in everything. And oftentimes we see it so much that it means nothing. I guess put simply, in the transportation context, I view equity as making sure that we have, affordable, accessible, safe transportation that is serving everyone, and that we are making sure that not one community is gaining more of the benefits associated with transportation, and also, conversely, certain communities aren't bearing the burdens of the transportation system unfairly.
Mm-hmm. And I think the beginning of your response kind of got at the challenge we are facing in this conversation, I guess, trying to give a concept that is laudable but imprecise texture and meaning. And I think one of the ways we can do that is to kind of identify the ways in which equity as a concept can sort of struggle to address sort of competing values that we might have. So for example, sustainability is kind of one way to understand this challenge. Do we shift to maybe electric vehicles, or maybe use higher quality diesel that might run cleaner, but will be more expensive and create costs that are passed along to consumers, or maybe specifically low-income residents. I guess one way to ask this question is to say, who should equity prioritize? Should equity prioritize the poor, the average person, the pedestrian, local residents, or maybe some combination of all of these?
That's another difficult question. I really think it depends on the context that we're looking at. I mean, oftentimes we're looking at a particular organization who is trying to measure equity and define it for themselves. I mean, in general, we should be prioritizing whatever group has been historically disenfranchised, right? And so in the world of transportation, often that is stratified by income, by race, by physical abilities. And so depending on the groups that have been historically disenfranchised, those are who we should be prioritizing. You mentioned like pedestrians, so we can often see it across modes where car has been the dominant thing that we prioritize in planning. And so now there's been an increasing push to look at prioritizing transit users, prioritize pedestrians, cyclists, and so forth. And so I think it really does depend on the context. And the difficult thing is that often there are multiple groups who have intersectionalities that we have to prioritize. And how do you weight all those different things together to kind of create that, metric that we use to figure out which groups or which area to prioritize can be challenging.
Yeah, yeah, absolutely. And maybe we can sort of double click on one of those examples to kind of flesh out this idea further. Maybe you just touched on car ownership, for example, and I've heard you speak about this before. While it's true that we in the United States have created infrastructure that is tilted towards car ownership and sort of car dominance of the built environment, it's also true that for many, car ownership is sort of a way to achieve social mobility, to get better access to food, education, jobs, healthcare, and the other resources that they need to thrive in society and support their families. So how do you think about car ownership through this lens? Like, would an equitable transportation policy also promote car ownership for low-income residents? Or is that when kind of that balancing act kicks in and we need to think about other priorities we may have?
Yeah, car ownership and just sustainability in general is challenging, right? So we know historically communities have had great economic mobility due to the fact that they own a car. And so when you think about now trying to promote sustainable principles, we want to make sure that that's not restricting the economic mobility of groups, particularly those who have not benefited from that type of upward mobility. And so when it comes to, I think, trying to reduce single occupancy trips or car ownership, we really have to be intentional to make sure that there is an alternative mode of transportation that offers the same type of mobility. And if that does not exist, then I think we need to be very careful about how we penalize car ownership, and making sure that we're not, balancing sustainability on the backs of those who really may need that upward mobility the most. And so that means that we have to, if we're going to be limiting car ownership in some way, we need to be investing in what those alternative modes of transportation are. And if we cannot do that, then maybe we do need to consider other motorized ways of providing mobility, whether it be through car shares, even if it's not individual ownership, or making sure that those who are able to afford a car are also able to like pay into the modes that are more sustainable and look at how do we balance that out.
Mm. It seems like that debate kind of happens in real time in the discourse on complete streets, because that is sort of necessarily trying to cram all these different modes and all these different options for mobility into a single corridor. If you'd like, feel free to say more on that. I'd also like to kind of pivot at this point to this idea of measuring equity and thinking about what kind of metrics and data that you turn to, whether those are qualitative or quantitative, that researchers and policymakers can reference when making policy decisions on development.
Sure. So I guess to get at equity, there's many types of equity. I think people often hear about like horizontal versus vertical equity is kind of the first level that we hear about, where, horizontal equity is saying that if everybody is basically the same, then we distribute the resources equally. And then vertical equity is saying that in the cases where there's varying needs, we give more to those, with the most need. I often like to kind of look at equity in other segments, thinking about sustainability, that's really getting at what we call transgenerational equity, which is making sure that the decisions we make today, aren't impacting future generations, right? So that's kind of one of the big motivators behind sustainability. I think traditionally we think about, distributional equity, so making sure that our funding, our programs, our policies are being fairly distributed, and making sure that those benefits and burdens aren't unfair to particular communities. But there's all these different layers, and I think in the complete streets debate here, one of the issues is really at procedural equity, which is thinking about how do we authentically engage the community and what that process is that develops our programs and policies. So for background, for people who are not from Baltimore, Baltimore passed a complete streets ordinance that sets a modal hierarchy in the city. And so it prioritizes walking first, and then at the lowest level is single occupancy vehicle trips. I believe cycling, transit, micromobility is at that second level, and then taxis, shared mobility, commercial vehicles are at the third level. So, the idea behind that was to, correct the fact that we've been a very auto-generated society, and to try to make sure that when we are putting very limited resources to use, that we are also thinking about, pedestrians and cyclists and other forms of transportation. So here, unfortunately, complete streets has kind of become synonymous for bike infrastructure. And there is concerns about who bike infrastructure is for and what the process was for installing these facilities and who was being engaged in the process. There's several work, I think, nationally about really just green infrastructure in general and the linkage between gentrification and is it a cause of gentrification? Is it a response to gentrification, and kind of what some of those parallels are? And so in much of the discourse locally about complete streets, it's really been on, who was being talked to when these policies were being made, as opposed to maybe not necessarily breaking down like the policy. So I think pretty much everybody would probably agree that walking, pedestrian safety is important. Everybody would pretty much agree on public transit. You get to the cycling piece, there's probably no agreement on that piece. And so I think a really big part of it was some folks in the community feeling like they were not part of that process and that they didn't have that inclusive engagement, and as opposed to what the policy was aiming to get at. And so I think this really highlights that, you can try to implement equity, like that was kind of the basis of this policy, but in reality, it's much more difficult than what it may seem on paper. And trying to capture all those different elements of equity in how you write a policy and also how you implement it can be quite challenging. And I know there is other parts to that question. Please.
Oh, that's all right. Yeah, we'll circle back to that in a moment. I had a follow-up question on your comment, because I thought that was very insightful. It's funny to me that the complete streets discourse, or at least a lot of the development ideas surrounding complete streets, defaulted to bike infrastructure in Baltimore. And I wonder, is that because transit, buses and particularly rail, are those just so difficult to do in Baltimore because of the prohibitive cost, because of the sort of bureaucratic complexities around sort of state ownership of the MTA and things like that? Is transit just so hard that bike infrastructure is just much easier to achieve, and so it becomes the default focus of that development paradigm?
That's an interesting question. I would say no, just because nationwide biking can be kind of polarizing. I think here, bike infrastructure is relatively new, right? We're pretty new to implementing bike infrastructure. And so because it's new, I think it's something that people are still really adjusting to. And it's being implemented at the same time where folks are seeing changes in the city, changes in terms of who's moving into the city and affordability. And so all those things are kind of happening at the same time, and it's causing some uncomfort. And, we have to keep in mind that these communities are not, that their experience is why they have some of this uncomfort, right? Transportation has not this has not always been used for good, right? Highways were largely built in lower income, predominantly minority areas. They've seen, those devastating effects on their community. We talk about redlining all the time here in Baltimore. And so there's a natural distrust with transportation projects that we have to, as planners and engineers, recognize and value that, because that is the experience of these communities, because it has not always been the case that we think about transportation in this sense. From the transit side, Baltimore is very unique, where our transit system, which is the Maryland Transit Administration, is a state-run agency where the majority of the service is in the Baltimore metropolitan region. And so that does come with some challenges that I think we may talk about later, but I think it's two very different things for this Complete Streets debate here.
Well, thank you. Yeah, I want to pick up on that point you made about sort of the rational distrust that communities may have towards different forms of infrastructure development in Baltimore City and beyond. This seems like a very serious challenge when you're trying to generate qualitative data that accurately reflects the needs of the communities that you're trying to serve. How do you address this? I think in a minute we'll kind of do more of a deep dive into some of your research surrounding food deserts to kind of illustrate this, but maybe you can talk a little bit about when you're generating surveys or other data collection techniques that seeks to directly engage disaffected communities. How do you do that in a meaningful way?
I think first it's to gain the trust of the community that you're working in. Oftentimes, a lot of my projects actually stem from just listening and being in the community as opposed to something that I've thought of. I think the food access project is one of those examples that kind of fell into the space. Student transportation was another one. So I think that's the first step, is to make sure the research that I'm doing is aligning with some of the needs and priorities of whatever groups I'm working with, whether it be community organizations, whether it be the government sector, politicians, and so forth, because that makes it easier. They have to care about what you're doing. And so what you're asking and how you ask it, I think, really does matter. In terms of the data, it's a balance, right? So there's some data that's very easy to get, like census data, American Community Survey data, where we know what the general demographics of an area are. That's kind of like the low-hanging fruit when it comes to these type of studies. I think it's more difficult to see what individual preferences are and what factors into individual choices, and that's where some of like the surveying work comes into play. But it's very time intensive. It's also, if done right, can be expensive. One of the things I talk a lot about is making sure that we're kind of demonstrating equity when we go about doing research. And so that involves, how you approach communities, making sure that you're compensating people for their time. And all of that requires a lot of legwork at the beginning that often we don't have the luxury of doing. With major transportation projects, I think one of the biggest challenges is before data. It's really easy to kind of measure the after, but often we didn't necessarily have the same type of data before to compare to. And then just having the non-transportation data is challenging. I think especially for engineers, we're still kind of new to merging like quantitative and qualitative data together. There's also no real standards or metrics in terms of, what to look at, how to combine them, how this may impact, what you do with it once you measure it is also something that's important. We can measure disparity all day, but really we want to correct those disparities. So that also means making sure that the people in power who can correct these things, one, know the work that you're doing, to value the work, and that it's something that is kind of done in mind with how it can be used, whether it's being used by civic leaders, whether it's being used by community groups and advocates. So I think what we measure is important, how we measure it, and also how we report what we measure back in a way so that it is usable by multiple groups is important.
I want to zoom in a little bit on your research on food deserts, since you brought it up, and because I think it's very illustrative of the issues that we're trying to address here in this conversation. So just as a primer, why did you, as a transportation researcher, gravitate towards issues related to food distribution? Maybe you can talk about your work in that space more broadly.
Yeah, I fell into it. Actually, a student, one of my students first brought the topic to me for his senior project. It was an undergraduate student, and he was really interested in different food desert or food access measures and kind of why they were so different depending on what you're using. But for me, I just like to deal with problems that impact people's lives every day. So food is one that once I got in it, there's multiple connections, access to work, access to school, access to healthcare. It's all, similar tools to address different problems of accessibility.
Yeah, I think that makes a lot of sense, actually, when you think about it. It's those issues that kind of hide in plain sight that I think are very attractive to developers, urban planners, researchers, just the basics, Would you also tell us a little bit about the history and the consequences of food deserts, particularly in Baltimore City? I think in Baltimore, it kind of gets tangled in a lot of other sort of historical traumas the city has faced through, as you mentioned earlier, redlining and things like that. So can you talk about what redlining looks like in this city?
Yep. So in Baltimore, we have this kind of term called the white L and the black butterfly, right? So in Baltimore, a lot of the wealth and prosperity kind of lies along the central north-south spine of the city going east. So that's the L, and of course it is majority white, and then it's flanked by the lower income or mixed income, not necessarily all lower, but mixed income areas of the city. And that's what we're calling the black butterfly. And so due to the history of redlining, there are very strong differences in social economic indicators in different regions in Baltimore. And it can really drastically change, like you cross a street boundary and you'll see very drastic changes. And then you go back and look at those old redlining maps and it almost exactly matches that. And so you can kind of see the history of the systematic things that we did to separate and segment populations, how that's still evident today. And so, of course, in those areas, which were those that were traditionally redlined, they do not have a lot of access to grocery stores or to just fresh and healthy food in general. And part of that is the economics of the area, right? So it's been pretty difficult for a grocery store to be sustainable in those areas. And so we don't have a lot of grocery stores. We have corner stores, we have dollar stores in those areas and not large scale grocery stores. And so what that means is in communities that already are dealing with very limited budgets in general, right, they now have to devote a good portion of that budget in transportation to actually access the grocery store, which then limits what they can spend on food. It may limit how often they can grocery shop, what they're purchasing, because of those trade-offs that they have to make.
As somebody who lives on the border between the white L and the black butterfly, for what it's worth, it really is quite shocking when you pass this border. And I think that the very visible disparity really highlights the importance of this work. So as it relates to this research you've done, and specifically this paper that I'm pointing to, understanding access to grocery stores and food deserts in Baltimore City. Can you just kind of walk us through the methodology? I know you've talked about it a little bit already, maybe how you designed your survey strategy specifically for this project, how you sort of did the statistical analysis afterwards, and what were the recommendations you came up with based on the results of the study?
Sure. So that study was done well, several years ago. It was pre-COVID, so those COVID years kind of fly. So as I said before, the kind of the goal was the fact that we see that there's all these different metrics for food insecure areas, and we know what people use these metrics for. So they're identifying these geographic areas to focus investment on because those are deemed food insecure. And so when looking at those definitions of food insecurity, vehicle access was almost always included, income was also included, and then sometimes other things as well. And so what we wanted to get at was to understand what the role of transportation is with grocery store access, and in particular, the lack of vehicle ownership. And so we felt that the only way to do this was to talk to residents. When we looked at metrics, most looked at the distance to the nearest grocery store. So that was the first thing, where I know that myself, I go to several different grocery stores depending on my needs. One of the first things I wanted to look at challenging perhaps was, should we even be considering where the nearest grocery store is? Because that nearest grocery store may not have the food you want. It may not be affordable to you. There's all these different things that why you may skip, the grocery store that's nearest to you. So what we did is we surveyed residents in Baltimore City. To do this, we were really fortunate that we were able to partner with grocery stores. We wanted to make sure that we did on-the-ground surveys, just because in the online environment, it's really hard to ensure that you are actually surveying the population that you're trying to get. And so the way we were able to do it was we partnered with grocery stores, and they allowed us to stand in front of the grocery store because we bought gift cards to their grocery store. So we said, we'll buy gift cards for your grocery store, which meant more money was going to be spent in your grocery store. And we also know that we were surveying people who are clearly shopping in the city. And so we made sure that we were at different grocery stores of different types and qualities, different locations across the city, and did our survey on the spot. We also did some online surveying, but the majority of our stuff was at the grocery store. And so we asked several questions, but in terms of kind of like getting at that food insecurity metric and how it relates to transportation, there was kind of 4 different things that we looked at quite a bit. So we asked them questions about where they shop, where their home is located, how often they shop. And what we found was that people were not, of course, shopping at the grocery store that was closest to them, as we had expected. We saw that, of course, if you had a vehicle, you were able to shop more often. You often shop further away from home. And so then we decided to run a CHAD decision tree to look at the individual factors that influence a particular outcome, where in this case, the outcomes was the quality of food at the grocery store you're shopping at. So that was this healthy food availability indicator that Hopkins has created for grocery stores in the area. We looked at the number of different grocery stores visited within a month, the number of trips you make to the grocery store within a month, and then are you shopping at the nearest grocery store? And so with that, we were able to look at different factors. We were able to kind of look at what that income threshold is, because different metrics use different kind of income thresholds. We found that income was more important than vehicle ownership. So in the metric we focus on income over vehicle access, because of course they're very closely correlated. And then we also created this prioritization metric where we found that people were largely visiting grocery stores within 3 miles of their home. So we looked at, the number of grocery stores that you could get that were within 3 miles of their home, as well as the number of grocery stores within half a mile, which was kind of like that cutoff for access without a car, and created a way of prioritizing which areas should be invested for food insecurity.
Excellent, excellent. At this point, I think I'd like to pivot towards the engagement section of this conversation. That is, how do you, as a transportation researcher and a person who has really, I would say, indispensable knowledge on urban planning in general, how do you participate in the many organizations you do? What perspectives and priorities do you bring to them? Yeah, let's start with that. These are very large civic organizations that often incorporate people from bureaucracy, government, experts, and things like that. What do you see your role in an organization like, say, the Baltimore Regional Transit Commission? What are you bringing, and what perspectives are you trying to highlight with your presence and your voice?
Good question. I would say the first thing that benefited me was actually living in this place that I worked. So I lived in Baltimore City for over 10 years. And so I think that was, I would say, the most critical piece to the work that I do was just, you know, having daily experiences. It also makes you comfortable to talk to the communities if you live next to them. So that I would say that was foundation, which I know you can't do that in all circumstances, but I do think having the experience of lived in a variety of places, urban, suburban, et cetera, is beneficial. In terms of the different organizations, so the Baltimore Regional Transit Commission is the newest organization that I've been part of, but I would say prior to that, the one that I've spent most of my time in has been the Central Maryland Transportation Alliance. And the goal of that alliance is to promote transit in particular in the Baltimore metropolitan area. And that one has been beneficial just because the members who make up the group cover advocacy groups, they cover businesses, they cover people who are practitioners in this space, as well as myself as an academic. They also have representation from a lot of the large organizations here in the city who do have a lot of power. So that's been an interesting and a good experience of just kind of hearing how all those voices meld together for advocacy. The Baltimore Regional Transit Commission is new. So I guess I should give some background first.
Sure.
So here in Baltimore, I think I mentioned this briefly, but we are a state-run transit agency where the majority of the services focus here in Baltimore. And that has caused issues over time with one, the agency has only answered to the governor, which we know can change quite often. So if a governor changes, the priorities of the transit agency may also change, and that makes it really difficult to do long-range planning, right? And to really correct from an equity perspective, you need to be able to plan in long planning horizons, which they just, they can do so, but then a governor could come into office and change things. So here, the big thing was the Red Line, which was an east-west train that was to connect East and West Baltimore together. When our previous governor got into office, he removed the state funding for the Red Line, thereby canceling the project because it could not go forward without the state funds, while maintaining the new rail line that was being planned, the Purple Line in the DC metropolitan area. So there was all kinds of questions about equity that arose with that, about transparency and how decisions are being made, that procedural equity piece. There was also a lot of conversation about why are we operated like this, where we're out of the 35, largest transit agencies in the country, we're the only one that is a state agency with no board oversight. So there's been several kind of projects that led up to the creation of the commission, where I think majority feel that the ultimate goal is an authority. So the main difference between a commission and an authority is the commission, we are here to, provide some transparency in the budgeting process. We provide some sort of oversight and accountability where MTA now, speaks to the commissioners. And, we serve as advocates for the regions that we're representing. But the main thing is there's no financial buy-in by the local jurisdictions. And so the creation of the authority would require that local buy-in. And so in the planning up to the commission, we kind of paused that commission because it was felt that a lot of work needs to be done to get to the authority stage because of that financial piece that makes it a little bit more challenging to implement. So this commission is kind of seen as an intermediary step until we can kind of work through the difficulties of establishing an authority. So in terms of my role on the commission, I serve Baltimore City. So I'm one of Baltimore City's representatives. There's representatives from the governor's office as a state agency. There's also representatives from the various counties around Baltimore, like Baltimore County, Anne Arundel, and Howard counties. So my goal is to serve the needs and to represent the city. I also serve as like the academic perspective too, on the commission. So, I can bring in some of the national best practices that I know about, things like that. So there are people who are way more experts in transit who have been like practitioners in this space for many, many years. There's folks who serve from the advocacy space. We have people who represent the operators of transit and the workforce needs. And so we all kind of come together to try to make transit as good as we can for the region.
Yeah, from how you describe it, it seems like one of the primary benefits of civic organizations like these is one of sort of coalition building, of getting disparate groups on the same page to push for a single cause, be it the creation of a regional transit authority, or maybe just broader goals about like increasing transit access, and sustainability and things like that. Would you generally agree with that, or is there something more that does?
Yeah, so in terms of the coalition, I think the coalition building was a very strong factor as to how we got the commission. I mean, the commission is now legislated, right? So now we have to have this commission. But there was a lot of coalition building that led to this. I think Central Maryland Transportation Alliance went into like funding kind of a study that looked at the different organizations. Then the Baltimore Metropolitan Council created a work group, which I served on. And then we finally got to the commission. So it's been a multi-year process. Many advocacy groups have fought for this. They're still fighting for an authority. We talked to some groups, commission is not nearly enough. They really wanted the authority now. And so that's another where there's, sometimes on paper, we all know authority is what would be best for the region, but then the work group, which I served on, really felt that there was a lot of challenges that need to be worked out in terms of how that authority would be created. How do you get local buy-in, particularly from some of the counties that don't have a lot of MTA transit service? And so that's why this kind of intermediary step was the recommendation, but there's still legislation and things going towards the building of the authority.
At this point, I want to turn to some of the audience questions because they're asking about some very timely issues, and I think that they could serve as interesting case studies, both for the equity and the engagement parts of this discussion. The first thing I want to point to is the Key Bridge collapse. And so maybe we could think about like sort of the equity dimensions of the collapse, maybe as it relates to, say, white collar work from home employees versus those who need to travel to work and things like that, and maybe how institutions like the ones we've been talking about can respond effectively in a way that's data driven. I know that's very broad, but maybe you could just share your thoughts about that.
Yeah, I actually took me and my daughter yesterday went to Fort McHenry.
Mm-hmm.
We saw the bridge. It's So there's a lot of facets to it. I think in the near term, jobs and this job accessibility is really important. That bridge served as a connector to the port, to Trade Point Atlantic, where Amazon, Sparrows Point is. And so it makes an important job center in the city very difficult to access. And I think the nature of that makes it so that this collapse not only impacts some of the neighborhoods who are on either side of the bridge, but also just others who are working in that critical job center. And so, of course, those jobs are jobs that you have to physically go to, as opposed to, myself, I work from home at least 2 days a week. And so I would not feel that impact the same way as somebody has to go in 5 days a week, who hopefully still has a job, right? So I think there's these kind of short-term implications of the collapse, and then there's the long-term ones that may result in long-term loss of jobs. I know there's been a lot of talk locally within the politicians in the area to make sure that these short-term impacts and become long-term impacts, or we see permanent shifts in jobs leaving the port area and Baltimore in general. And so that's really important. In terms of the neighborhoods who are just kind of on either side, of the Key Bridge, they're quite varied in terms of social economics. I mean, you have some neighborhoods, I think, where about a quarter of the people don't have access to a vehicle. And then you have other neighborhoods where like 2% of people don't have access to a vehicle. And so those impacts will be felt very different, right, in those various neighborhoods. Racially, it's pretty mixed. It's actually probably more white neighborhoods than Black neighborhoods around the Key Bridge. We hear a lot about the impact of Baltimore City, but really it's Baltimore County because it's right on the edge of Baltimore City. So it's really kind of the neighborhoods in the county that will feel those impacts. I think for those who are closest to the port, it will be interesting to see how the traffic diverts and how much will be shifted to the neighborhood streets, which of course will have safety, noise, emissions, health impacts to those communities. And just in terms of traffic, it is a little bit worse from my own personal experience. I mean, the bridge, I think, carried about 34,000 vehicles per day. I think our tunnels carry about 100,000 vehicles per day. So in that scale, it's not the most critical, but it's also the only one where like hazardous materials could go over. So now any trucks that are hazardous have to go all the way around the city. And so it's an interesting case study from an equity point of view because we see, a lot of resiliency issues in the transportation system, but because it's a bridge, it's going to take so long to rebuild. And so really looking at short-term equity issues versus long-term equity issues, I think will be something that we'll be able to learn from this unfortunate situation here.
I'm glad we're recording. I think that was a fantastic synopsis of the challenges that this very acute incident has put on the transportation network. Moving from this acute crisis to a sort of chronic illness of the city, we had another question about the highway to nowhere, and I was hoping you would give that a similar treatment as far as studying equity in that context, responding to it through civic engagement, things like that. What's your diagnosis on that notorious problem for the city?
Okay, sure. So the highway to nowhere is a section of our interstate highway that was built on like the west part of the city near the West Baltimore MARC station, where the full span was not built due to the freeway revolts at the time. In that small section of the highway, multiple families were displaced. It really kind of bisected that neighborhood and has had real lingering impact. So it's just a very small segment of road that you can quickly go at high speeds and then you quickly get dumped off into local streets. So there's been a lot of talk about what to do with that space. The Reconnecting Communities grant is one that I know that corridor has been looked at. And I think our state senators who helped create that legislation, this was one of the kind of motivators behind it. So some talk has been our new red line will make some purpose of that corridor. There's also been talk about maybe, creating like parks and public space that can then be used by the neighborhood who was most impacted by the creation of that portion of the freeway. But right now it's a gap that's really just bisecting that neighborhood.
Mm. You said something earlier in the conversation that really resonated with me. You said part of what inspired you to get into some of the nuts and bolts issues around things like transportation and food deserts was just living here. And I think that was a big shift in my own life, is just moving to Baltimore and kind of seeing these problems firsthand every day and really feeling inspired to do something about it. So in that vein, what advice do you have for young transportation professionals, researchers, urban planners, people like that, or just maybe somebody who wants to make the place where they live better?
Yeah, I would say one, people's lived experiences are very beneficial. So your own personal ones you can use, as well as listening to the community and hearing and valuing their lived experiences. I mean, my lived experience can't cover everything that I'm going to see as a transportation planner or engineer. So I have to rely on the community and their expertise as residents of the area. And so I would say just for students, particularly those who are kind of in the STEM fields, to not be afraid of social sciences instead of some of the
Tell 'em.
concepts, that we have that is kind of bridging the social science world to the engineering, transportation planning world. As a as a professor, I try to bring some of that into the curriculum. I think it's still a challenge where, some of our licensing and stuff doesn't quite reflect that. So trying to balance, what I need to teach versus some of those other topics is a challenge. And I think just in general, the heart of transportation is humans and making sure that they are either able to move to get what they need or that we're able to bring what they need to them. And so just keeping that in mind that we are in a human-oriented field, even though day by day you may not interact with people, and to just keep that in mind when designing the transportation facilities is important.
I couldn't have said it better myself. I think that's an excellent place to end. I would like to thank you again, Dr. Chavis, for being our first guest here on Spartan Transportation Talks. And I would like to thank everybody who decided to join us here as well today, and those of you who asked questions to join in on the conversation. Again, I'm Joe Niehaus. This has been Smarter Transportation Talks, brought to you by the Smarter Center here at Morgan State. And I wish you all a wonderful day. Thank you again for joining us.